So, you have a healthcare assistant interview. Congratulations, and you're preparing for some of the interview questions that may come up. Now, this is an interviewer favorite. Every time I attended a healthcare assistant interview, I was asked this question. And when I took part in conducting healthcare assistant interviews, this was a question that I asked as well a lot. So it's definitely a question that may come up in a healthcare assistant interview. Now, an interviewer may ask you that give me 5 types of abuse that you know. Now, we're going to start with the easy ones, the more common ones, and then I'm going to give you 2 that some people actually don't think about. Now, the first one is physical abuse. This is a very common form of abuse. It's very well known, sadly, but this is physical abuse. This is, let's say you're working in a healthcare environment, in a nursing home or in a hospital, and you physically abuse a patient by hitting them. This would be considered physical abuse. But physical abuse doesn't necessarily mean hitting somebody only. Grabbing somebody, very violently, pushing somebody, pulling somebody, that would be considered as physical abuse because you're using force to, hit them. You're using force to push them out of your way, for example, or using force to pull them. That would be considered physical abuse. You can look up physical abuse and you can elaborate more in your own words what you know as physical abuse. The second type of abuse that is also very common and well known is sexual abuse. Sadly, sexual abuse does occur in hospitals, in nursing homes, in the healthcare setting. Sadly, some people are just very sick, so this can occur. They could be touching of patients inappropriately or talking to patients in an inappropriate sexual manner. That would also be considered as sexual abuse. Now, the third type of abuse can occur in a nursing home, hospital setting, any healthcare setting, and it does occur more often than you think, and that is emotional abuse or verbal abuse. So talking to a resident in an inappropriate way, shouting, screaming, that can be considered as emotional or also be considered as a verbal abuse. Abusing residents emotionally is considered abuse and is grounds for dismissal. So this is an abuse that you want to talk about during a healthcare assistant interview to show the interview that you do have an understanding of this type of abuse. Now, I am going to give you 2 more types of abuse that you want to bring up during your healthcare assistant interview. Now, one of these is financial abuse. Now, you are going to be thinking, oh no, that doesn't occur in a nursing home or in a hospital because most patients don't bring money with them. They don't have a lot of money with them. You don't have access to their bank account details, but this can occur in a nursing home or in a hospital. Now, some people fall into this trap without knowing, without realizing, and then they get slapped with financially abusing a resident. Let's say you work with client A and you're taking care of client A, everything is very nice, and then one day client A comes to you and says, look, here's 10 euro here to thank you for your service. Client A is alert, she is in good state of mind, you accept the 10 euro, no harm, no foul, you think. But that is financial abuse. As a healthcare assistant, as a nurse, you cannot accept money or any form of payment from a patient or a resident. That is why you are paid a salary. You cannot take any form of payment. Just say to client A, thank you so much, client A. That's very nice, but I cannot accept this. This is part of my job. You do not have to pay me, but thank you so much, and move on. Never accept money or cash from a resident or a patient. Now, it also happens that patient comes in and their family gives the money. I'm going to say £100 note. They put the £100 note under their pillow. As a healthcare assistant, you come in and then you are changing sheets, and then you find this wonderful £100 note under your pillow. And then you think, this is the answer to my prayers. This is what I've been seeing on Facebook, that money will magically appear, and you take that for yourself. No, 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 no. Put that money back. It's not worth losing your job and getting deported just because of €100 or £100 note. That is theft, and that is considered financial abuse. The last one is actually one of my favorite questions, I don't want to say my favorite types of abuse, but one of my favorite answers when somebody is talking about types of abuse. And this is one that a lot of people actually forget, a lot of healthcare assistants actually forget, but it is very important, and bringing it up shows that you know the different types of abuse that can occur in a healthcare setting. And this is negligence. Yes, negligence is a type of abuse. Let's say in the morning you're doing morning care. You decide that client A is due for a shower today, for example, but then you decide that I don't feel like it today. I'm not going to give her a shower. I'm going to give her a wash because it's quicker and it's faster instead. So you give her a shower. And then you do it again, you do it again, you do it again. That is considered negligence. You are neglecting taking care of that resident and following the proper steps of care. Now, this can also occur with eating. Let's say you have client A. Client A is wheelchair bound, but you bring her food, you put it on the table, and you leave the table far from her, and she cannot get to the table. That is negligence. You neglected bringing the table to her and making sure that she can access the things that she needs easily. This is a type of abuse that has so many faces, it has so many facets. There's so much that you can bring in, there's so much that you can say with this type of abuse. It shows that you are well read, you understand your position as a healthcare assistant, and you will be a valuable team member. And this will make you stand out in a healthcare assistant interview and hopefully lead you into landing that healthcare assistant position. Now, in the next video, I am going to answer how you can tackle these types of abuse when you come across them. What are the steps that you should take if you think a patient is being abused, and what are the steps you should take after you have reported the abuse. Thank you so much. If you enjoyed this video, please consider subscribing, and I will see you in the next one. Bye-bye.